Hello, my name is Michael West. I am Senior Visiting Fellow at the King's Fund and Professor of Organisational Psychology at Lancaster University, and I'm very pleased to have this opportunity to offer some thoughts about how we can care for ourselves during this really challenging and difficult time for all of humanity. And I want to talk particularly about how all of those who work in health and care services, in the voluntary sector, those who are preparing to work in health and care services also, can really pay attention to, think about and act appropriately in order to ensure our individual and collective health and well-being. What's clear is that the challenges we face are going to go on not just for weeks, but for some months. So this is a long-term process, and it's absolutely vital that we care for ourselves over the long term and avoid the danger of really burning out in the very short term. I want to acknowledge also that I and everybody, I think, feels some fear, a great deal of uncertainty, the loss of many of the structures and processes that underpin or have underpinned our lives up until this pandemic began. And also the fact that what we're seeing is an enormous outpouring of compassion and support and care and love in our communities, in our workplaces, amongst our colleagues, and that is an enormous source of support for all of us. And I just want to stress a few of the really, key elements that help us to be well, to sustain ourselves during difficult times. The importance overall, by far and away the most important factor, is spending good quality time with people we love, the people we love and the people who love us. Our families, our partners, our friends, our children. It's above all vital for all of us that we ensure we're creating that quality time where we can have that experience of belonging and connection and love. Because it really is fundamental to our ability to sustain ourselves and to be loving and compassionate to others. So although I know everyone working in health and social care and in the voluntary sector and all of the volunteers and those who are preparing to work in our health and care services are currently under enormous pressure at the minute, it is vital that we carve out the time to be with the people who love us and who we love and to spend quality time with them. And of course, you know about the importance of exercise and good sleep, the importance of taking exercise at least 2 or 3 times, 4 times a week if we can, even during these busy periods, and in a way especially during these busy periods, and trying to ensure that we're getting 7-8 hours of sleep. Again, it may feel like, well, we have to limit the amount we sleep because of all of the work we have to do, but given this challenge is going to go on for months, it's vital that we work to develop good sleep hygiene and to give ourselves the sleep that we need. There's also, really an increased sense of understanding about the importance of being present as we live our daily lives, that the more time we spend being anxious about the future and the more time we spend ruminating about the past, the less able we are to be present. And being present is associated with much better well-being, much greater sense of confidence and security. And again, I know that many of us are experiencing anxiety in relation to the challenges that we currently are addressing and also that we will experience in the near future in relation to this crisis. So it's really important, I think, to acknowledge those thoughts, those feelings when they come along, not to reject them, but to accept them, but then to come back gently to the present moment. And that may be about reconnecting with those elements of our lives that give us a sense of confidence and safety and security, the love of our families, the love of our friends, the support of the people we work with in our work environments, reconnecting with nature that's all around us, despite all that's going on in human affairs at the minute. The rivers are still flowing, the hills are still standing there in their mightiness, the trees are still growing, the birds are still singing. And that connection with nature in the present is a real source of safety and security and continuity as well. Just the sight of a leaf and its beauty, and the sight of flowers around us during spring and early summer, so important for our sense of connection with all of this and the sense of continuity and safety and almost like a safe refuge. And the practice of mindfulness meditation techniques is a really direct way of encouraging a sense of presence and being in the present moment. And we have, of course, the privilege of being involved in work which is about caring for others and helping others. And that in itself is an important source of well-being. But perhaps most fundamental to all of this is compassion. Compassion is the most powerful intervention that we know of in health and care. There's nothing that comes close in terms of its impact upon patient outcomes and indeed upon clinician well-being. Compassion is about how, of course, not just how we relate to patients. It's vital in terms of our care for patients and our care for their families. But it's also vital in terms of how we care for each other and the support we give each other in the workplace makes just an enormous difference to our ability to cope, to be effective, and to deliver for the people that we serve and the communities we serve. So showing compassion to others, the people we work with, is especially important, whether that's taking time as teams or to check in with each other or having a buddy who we check in with on a regular basis is vital, but also ensuring that as leaders we exercise compassionate leadership. Compassion is about paying attention to the other, being present with them, listening with fascination to them. It's about understanding the challenges they face and empathizing with them, caring for them, and then taking intelligent action where we can to help them. And fundamental too is then the importance of self-compassion. In order to have the resilience and the capacity to deal with this enormously challenging situation, it's vital that we're compassionate, that we pay attention to ourselves, understanding the challenges that we face, and caring for ourselves, empathizing with ourselves, caring for ourselves, and then taking action to help ourselves in order that we can be the best we can be in these challenging circumstances. Self-compassion is the basis for our ability to be compassionate with all others. So I think it's the beginning point of ensuring that we care for ourselves, along with the vital commitment to spending quality time with the people we love and who love us. So, although as health and care professionals we're often very much focused externally on caring for others, it is vital, if we are to do that successfully over this challenging period, that we care first and foremost for ourselves. Thank you.